Hey everyone, it's Dr. Natasha Nelson with Above, Down, Inside Out, A.D.I.O. Welcome, I'm so excited about today's episode. This is an episode that really goes to the root of what I do and kind of goes back to a lot of where health and wellness really started for me. And I want to talk about kind of like my profession, I guess, where it all started for me and what is a chiropractor and I guess what is chiropractic. So why don't we start there? Because, like every profession, there are good, there are bad, there are those in between. There's a lot of misinformation, a lot of bad information. So I want to talk today about chiropractic and what it is, what it's not, what it does, what it doesn't do, and hopefully gives you some insight into possibly an avenue of health and healing that you may not have considered. So let's start with the beginning, the basics, chiropractic. What is that? Chiropractic, what a word, right? So if you break it down, the word chiral, it's the root, which means handedness. And it comes from, I had learned it first in chemistry when you talk about like the mirror image of your hands. They're the same, but the mirror image makes them different. So chiropractic is really about the practice that's being and the art of wellness and healing done by hand. So what does a chiropractor do? Well, let's start with the basics of the human body. The spine. You've got 12 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, all stacked together. And in between each vertebra, there's a disc. The disc is designed to absorb shock when you walk, when you lift. It gives the spine all the flexibility in order for you to move and bend and just function, just do what you're going to do. The disc also provides space between the vertebrae so that the edges of the bones don't touch. Because yes, it would be painful, but it's also what would restrict the movement of the spine. But I want you to think even more than that. Think about what the vertebra does is it protects the spinal column. So the communication system of your entire body, your brain and your spinal cord and the nerves. So the brain sends signals down the spine. You have the nerves that go from the spine to all of the organs and muscles and parts of the body. And so it's just this communication where the brain tells the body what's going on and what to do. And then the body is telling the brain what's happening. So it's this constant communication and a feedback loop so that the body knows what to do at all times, whether you're awake or not, and unconscious, sleeping, aware of it. It's happening all the time in ways that we don't even really understand and so many levels. So the discs, one of the things that's vital for a chiropractor to look at is the disc between the vertebrae. The disc, yes, as I said, prevents the bones from touching. But what the discs also do is it creates space for the nerves to come out from the spinal cord to the body. So you have a hole, an opening where the nerves come out. Well, if you didn't have discs, that hole would get smaller. So the discs are there to prevent compression or irritation on the nerves when they come out from the spinal cord to the body. So when you look at the body and you look at the spine, whether it's from the front or from the back, it should be straight. And any variations of curves to the side is called scoliosis. Now, when you look at the spine from the side, it's supposed to have curves, 3 curves. The neck, the cervical curve, the thoracic curve, and the lumbar curve. So it's kind of like an S. And you need those curves because that's what allows the flexibility and the body to absorb shock. It allows the body to move, because without that, the curves, everything would be very rigid and very stiff, and the discs and the muscles wouldn't be able to absorb the day-to-day things that happen. So now, as a chiropractor, we look for any misalignments in the spine. Those misalignments in medical terms would be called a subluxation. And a subluxation, it means misalignment. Now, it can be any joint of the body can be subluxated, misaligned. But from the chiropractic, let's just talk and keep to the spine. So life happens, and it can be a traumatic event, a fall, or being hit, a car accident, but that can cause these misalignments in the spine. But that's not always the case. You could sleep wrong and your head is crooked, and over time that leads to a misalignment. But it's also muscles can be altered in how they function, which pulls on the spine in different ways. And left uncorrected over time, those muscles can cause a misalignment. And you can have a misalignment in the spine that causes muscle irritation and decreases its proper function. So they go together. So thinking about how the body works and the foundation. The whole premise of chiropractic is really looking at the communication system from the brain to the body. And nerve interference caused by a misalignment of the vertebra causes nerve interference and interferes with the body's ability to function. That is the fundamental philosophy and root of chiropractic and really the body itself. Because even if, every medical profession, whether it's PT, physical therapist, orthopedic, all understand the brain tells the body what to do, the body talks to the brain, and it's this feedback loop. So a nerve interference is from the vertebral point of view, like looking at the vertebra. A chiropractor uses our hands and sometimes, a machine if necessary, but primarily the hands, to realign the vertebra that's misaligned in order to allow the brain, the nerves, the body, all to communicate without interference. And this starts from before birth until death. So, from the chiropractic philosophy, this is the foundation of why I even named my podcast A.D.I.O, which stands for above, down, inside, out. Because as a chiropractor, I believe, not all chiropractors believe this, but it's the fundamental roots of our profession, that health and healing comes from the body's innate ability to heal itself. So that when you have a cut on your hand, your body tells the brain there's a cut, your brain tells the body what to do so the healing can happen. This happens when you get cut, this happens in your insides. The fundamental philosophy is that if you allow the brain and the body to communicate without any interference, the body knows what to do. The body knows what to do from before birth. This is how the body develops from the time that egg and a sperm come together. We call it the life force. It's energy. It's the spark of life that allows cells to divide, cells to heal, the body to function. And this was so rooted for me when I was in anatomy labs, and my first day in the anatomy lab with the cadavers. And when you see a body on the table and you see a cadaver, it's really apparent that the only difference between a cadaver and a human being is the life force. It's life. It's the animation of what brings life to a person is the life force. And it's the same life force that allows the body to know what to do, when to do it, and how to do it. And the philosophy of chiropractic is if there was no interference, then the body would know what to do and how to function and how to heal. So this is where chiropractic comes in. Most people come into an office, or at least, they came into my office because of pain. Usually low back pain, headaches was a close second. And it was important for me to do a full workup on the spine and posture because the entire system is connected. And while pain is one symptom, it's not the only symptom that lets you know that the body is not functioning properly. Because you can have irritation on the nerves in the low back that don't produce pain, but the nerves in the low back go to the digestive system. So you can have digestive disorders, issues, constipation. The low back nerves also go to the reproductive organs. So you can have issues with cycles or cramps or fertility. So chiropractic does not cure anything. Chiropractic does not cure any symptoms or any disease. The whole philosophy of chiropractic is remove the interference from the vertebra that's compressing the nerve, allow the nerves and the body to communicate, restore the function, and then see what the body can do on its own. And there are times when it is almost like a miracle. One of my favorite stories is one of my patients, her mom. She was a patient of mine, and she had 5 kids, and her youngest was about 9 months. And she was telling me how he wasn't able to go to the bathroom regularly, and the doctors didn't know what to do, and they were going to be taking him in for exploratory surgery to see if there was a blockage, why he couldn't poop. And I said, I don't know, but let's adjust him, let's check on him, let's see if it helps in any way. And so she brought him in, and we did the workup, and I adjusted the pelvis, and I did traction and helped his spine open up. And she left. And before she got to the car, she came back into my office and she said, oh my gosh, he just had the biggest poop in his diaper. And never was she so excited to see so much poo in a diaper. Because from that day, she realized this little guy didn't need surgery, but because he had been sitting and slumped in the car seat and, moving around, and as babies learn to walk and falling, and something got jammed up and misaligned in his low back. And that's one of those yes, amazing miracle of chiropractic, but that's not just what chiropractic does. Yes, chiropractic can make pain go away, but oftentimes being adjusted will actually increase the pain sensation. Because if you take pressure off the nerves, and they're pain sensitive nerves, one, you can make everything come alive and feel everything. You can have muscles that have not been working properly that are now able to move through their full range of motion, which can be sensitive and even painful. So sometimes chiropractic and being adjusted can increase pain and not necessarily just make it go away. It's not about making pain go away. So when looking back to the spine, and really with chiropractic is about looking at posture. Because we all notice posture when we're sitting at a computer or sitting on a couch, and you realize how it puts a lot of pressure that you lose the curve in the low back and your head starts to go forward. Well, think about when the head goes forward, the shoulders get slumped with it. And it puts a lot of pressure on the muscles of the shoulders and the mid-back because now they are fighting so hard to bring the shoulders back, to bring the head up, to restore the curve, to relieve the pressure of the nerves that go up into the head, around the face, down the shoulders and hands. So this is where too much time on a computer, too much time on a device, when the head goes forward and gravity is pulling down, it creates a lot of tension and tightness in the back of the neck, which can cause headaches, cause twitching of the muscles around the face. You can get numbness and tingling in the shoulders or hands. And same with sitting. When you lose the curve in the low back and you put pressure on the spine, you can have pain, but you can also have numbness or tingling down into the legs and into the feet. So this is why, for me as a chiropractor, I always look at posture, and everything that I did with the adjustments was about restoring the movement of the spine and restoring posture. Very much the same way braces are designed to restore the alignment of the teeth. Adjustments are designed to restore the alignment of the vertebra, to restore the curves of the spine. Because by doing that, you take pressure off the nerves, you stop the irritation along the discs, and you allow the muscles to function properly, which is their full range of motion is what allows muscles to be at their maximum strength and usefulness and reduces injuries. So I want to talk about one of the other things I look at. In chiropractic, one of the parts of the exam is to determine levels of arthritis. So this is where the chiropractic really understands arthritis in the spine and hopefully explaining it to you. Arthritis means inflammation of the arthro. Arthro means joint. And so it's inflammation. Itis is inflammation of anything that it's attached to. So bursitis would be inflammation of the bursa, tendinitis, inflammation of a tendon. Arthritis, inflammation of the joint, is inflammation of the bone. You can have it around the disc. You can have arthritis at any joint. So in the spine, arthritis, you can detect it on a lab or on an x-ray. But the first sign of arthritis in the spine is the loss of the curves. When you lose the curves of the spine, that would be considered phase 1, where yes, it can be reversed and it can be corrected. That irritation from phase 1 leads to phase 2, which is where bone spurs start to develop on the edge of the vertebra onto the disc. Those bone spurs, when they start to grow inside the nerve canal, now you're starting to put additional pressure on the nerve, which is why it can feel like a pinched nerve. That's where that is happening. Bone spurs are not reversible. You can't make them go away. What surgeons do is they will go in and shave them off and to relieve pressure. But you can't make them go away, not through adjustments and not through any other means. Phase 3 is where those bone spurs have grown so much to to the point where they fuse together. And that's that fusion that can completely shut down and cut off that nerve supply, and also completely restrict the movement of that joint in the spine, in your fingers, in the knees, anywhere the bone spurs have grown to where they fuse. And so this is what chiropractic is about. It's about preventing arthritis in the spine. It's about maintaining complete and full range of motion in the discs, in the joints, and relieving pressure of the disc and the nerve. And that's what the chiropractic adjustment is about. So I want to talk about this. I don't have a lot of pet peeves, but there's one that I have about chiropractic, and it's really about the words that people use. I am not popping your spine, because pop is like a soda. I am not cracking your spine. Crack is a drug. And I'm certainly not manipulating the spine, because that is just lack of integrity and the word manipulation. And so what I do with the spine is I adjust. I find the misalignment, that subluxation. And with the posture, with the movement, I adjust it. Now, the sound that you hear, the noise, it's air gaps that are trapped within the joint themselves, that the air gas is released with the adjustment. Very much like when a suction cup is pulled off of a glass, that air is released. It will sound much louder in the neck because it's close to the eardrums, and it resonates. You hear it louder than me as the chiropractor can hear it while I'm adjusting you. So one of the things that really matters to me as a chiropractor is how it translates into all of the work that I do now. The chiropractic philosophy about locating the misalignments, correcting those misalignments, and allowing the body to function properly is what I do now in my entire integrative health focus. But instead of looking at just the chiropractic, I look at all 5 pillars of health. So the physical, chemical, emotional, mental, and spiritual. All of those 5 pillars of health are vital for the function, for the health and the well-being of your body. And what I do is I go and I locate any misalignment in any of those 5 pillars, and I correct the misalignment, and I restore the function, and allowing those 5 pillars to work together, function together, and your body to flow the way it's meant to be. This is really the pillar, I would say, of, I think for me, the deep, deep reverence and dignity and integrity that I have for the human body. Because it's more than just the sum of its parts. It's so deep ingrained about this life force, about how our body is made, about the reverence for human life and how it relates to nature. That I truly believe nature has, you can call it God, you can call it life force, whatever works for you. But this life that makes us different from a cadaver. Our body knows what to do. Our body knows how to function and heal. And yes, we need to give it the support. And sometimes nutritionally, sometimes external measures need to be taken. But principally, on the inside, your body knows what to do if you give it a chance, as giving it a chance to do so as your first line of health and wellness and well-being. I love what I do. I loved having my chiropractic practice. I loved taking care of patients. I love what I do now as a coach because I can go into more in depth of the 5 pillars of health. And while I don't have a chiropractic office, I'm very involved with chiropractic and other chiropractors. And so if you are interested in really wanting to put together a full integrative health and wellness, program, I guess, for you, you can email me at drnelson@lifedoctor.guru. And while I may not be the one to physically adjust you, I can help you find the best chiropractor in your area for you. So this is where all of my training and really where it started was with the foundation of chiropractic. So yes, I adjusted, babies and elderly and everybody in between. And while chiropractic has a broad umbrella of what we could do in our practice, I was really focused on the adjusting because I wanted to adjust everybody. And I worked with acupuncture and physical therapists, massage therapists, functional medicine. Everything was part of it because it was so important and so vital. But the roots of chiropractic are still vital to what I do now. So if you would like to learn more about the 5 pillars of health and integrating that for you, like I said, go ahead and reach out to me, email me,